Like many of my colleagues, I've received a large volume of communication from constituents in Broxtowe regarding the ongoing problems with securing an NHS dentist appointment. Polling conducted by YouGov on behalf of the British Dental Association has shown that 1 in 4 adults in England have already delayed or avoided much needed care for reasons of cost. I'm aware that improving access to NHS dentistry is one of the government's key priorities for our health service. It is evident that waiting times have been affected by the degree of infection control measures that were required during the pandemic. Despite these pressures, dental services in many parts of England have been slowly recovering, which is positive, of course, to see. However, much more must be done to get down waiting times and ensure that appointments are acquired. As the Honourable Member for Winchester said, more gums on seats. The BBC recently contacted every NHS dental practice in the country and found that 91% were not able to accept new adult patients in England, and 80% not able to accept new child patients. This is not acceptable. Oral health inequality is rising, and we must act now to ensure that we are focusing on the retention of current dentists, the recruitment of new ones, and ensuring adequate funding is in place. One of my constituents, Sasha, contacted me to tell me about the difficulty she has had. Not being able to book a dentist appointment has caused her great stress and anxiety. She is faced with the situation of potentially losing her teeth if a dentist is not found. Sasha has gum disease and is supposed to see a dentist 4 times a year. She is in a position where she is facing great pain and does not have the option of visiting a private dentist. I have heard many cases such as hers. Often a private dentist is not an option, and not many people should have to turn to this. She currently is waiting for a response from NHS England. Another constituent of mine, Joan from Towton, recently shared her difficulties with me. Joan rang around multiple practices in her area to be told there were no NHS dentists available. Joan is 70 this year and should not be faced with not being able to get basic dental care. It is essential we fix this problem by ensuring that we have new NHS dentists entering the workforce as well as maintaining the ones we currently have there. The government has rightly been actively holding talks with the British Dental Association and other stakeholders to reform dental contracts since 2021-22. And through these talks, a number of steps have and are being taken, including improving financial incentives for dental practices, supporting new practices take on patients, and supporting people with dental costs. But more must be done. The Department for Health and Social Care has stated that it will be publishing a plan for dentistry in the coming months. I welcome this announcement and look forward to receiving the plan when published. In the meantime, I would implore the Minister to do all he can for those, such as Sasha and Joan, who are facing not being able to access dental treatment.
Thank you, Mr Deputy Speaker. First, can I take the opportunity